Hello and welcome to my presentation. My name is Jessica. This is my presentation titled Perceptions of Dietitians for my final project in my Qualitative Methodology course at Franklin University for the spring 2021 semester. All right, you ready? Okay, let's get started, shall we? Okay, so I chose to conduct a qualitative study regarding registered dietitians and how the public perceives their educational requirements, as well as their perception of a dietitian's responsibilities and how they can better market their services to the public. So a little background about dietitians. They work in a variety of environments, pretty much anywhere. You'll see from the results. And according to the Academy of Nutrition and Dietetics, abbreviated AND, dietitians are considered the food and nutrition experts. They have at least a bachelor's degree. They've completed a 1,200-hour internship. They also have to pass a national certification exam. And then on top of that, once you become a registered dietitian, you must every 5 years complete 75 hours of continuing education. As a dietitian myself, and knowing all of this, I realized a lot of people don't know the educational requirements. That was just something that was in my background. So this is one of the reasons that I chose this as a topic. So the overall purpose of this study was to gather an understanding of the public's general perception of RDs in terms of their roles, responsibilities, and how they can utilize them more as healthcare providers. The target population would be any adult who has opinions regarding, dietitians and their perceived roles in healthcare. The sample that we ended up using was a doctoral students in this qualitative methodology class for the spring semester. As far as method goes, it was this open-ended survey through Microsoft Forms. 2 of the questions were demographic questions, 1 question was of consent, and then there were 7 open-ended questions related to the topic of dietitians. So for the results, this is just a little bit of the demographics that we got back from the survey. 10 respondents total, 80% of them male, 20% female, and all of them were over the ages of 30 years old, and most of them were 40 and older. There was only 1 participant who was between that 30 and 40. As far as coding the results were coded in Excel for the demographic data. I used in vivo coding for the 7 open-ended. I literally used their words and made codes from their words. In order to do this, I used a program called Quirkos or Quirkos. I don't know exactly how to pronounce it, but I used this program. There was a 5-day free trial, and I used it. Basically, it color codes certain themes, and your themes can be whatever you want. So I ended up having 52 total highlighted sections, which in my mind is a code, and then out of those codes, they were categorized into 5 major themes, which were identified. These themes revolved around marketing, education, their personal eating patterns, the respondents, workplace for dietitians, and the benefits of seeing a dietitian. So as far as workplace, 21% of those responses were about where a dietitian works. Respondents were able to list multiple places, private practice, health centers, etc. As far as education, this was the least answered question. Only 3 people, so 30% of the people were able to list a master's degree, some kind of college education or something like that. 1 person just flat out said, I don't know anything about that. The majority of people, the respondents, felt that they had good eating patterns. They said things like 3 healthy meals, snacks, keeping weight in check, etc. They were able to list the benefits. This was actually the largest category. The majority of the answers revolved around the benefits of seeing a dietitian, such as lower blood sugar, live a healthy and better life, overall wellness, etc. Marketing was the other topic. 13% of the codes. Lots of suggestions here from the respondents. Online marketing, aligning with healthcare professionals, health insurance incentive programs. So a little discussion about the data. No respondents mentioned credentialing, licensure, a national examination, or the required 900 to 1200 hour internship. I think this possibly reflects that the general population is not aware of the legal and credentialing requirements. Most respondents were able to identify a benefit of seeing a dietitian, and most respondents were able to provide marketing ideas. So, to conclude, the study suggests the general public may have a good idea on the benefits that are received when participants participate in nutritional counseling and even how to market those benefits. However, there appears to be a lack of general understanding when it comes to the educational and legal requirements um, that are put on a person who wants to become a registered dietitian. Thank you so much for watching. This last slide is just a list of my references. Um, I sure do appreciate your time in watching my presentation. Thank you. Bye-bye.